Hello, today we are going to talk about a little bit of a history of Botox. So, how it came into cosmetic usage. So, if you look at primarily, this was a drug approved for blepharospasm. Blepharospasm is when your eyes are not opening. So, there are people certain, like there could be unilateral thing or bilateral, that they are unable to open up their eyes. तो होता क्या है कि आंखें खुलती नहीं है और आंखों का जो खोलने वाली मसल होती है वो बहुत टाइट होती है, उसके लिए ये यूज़ होता था और ब्लेफरोस्पैज्म ऑप्थेल्मोलॉजिस्ट इंजेक्ट्स करते थे आई के अराउंड और उससे वो रिलीज़ हो जाता था. सो बेसिकली बोटॉक्स वाज अप्रूव्ड फॉर स्पैस्म्स इन द मसल्स दैट वाज देयर एंड कॉमनली यूज्ड फॉर द पर्पस ऑफ ब्लेफरोस्पैज्म बाय द oculoplastic surgeons or ophthalmologist. Later on, one of the ophthalmologists' wife was a dermatologist. She noted that people who had blepharospasm, even their wrinkles were being treated. So they discovered this, observed this. By doing blepharospasm, they realized this, the eye wrinkles are also improving. So hence this using for the crow's feet started up. So इस तरह से एक observation से from one specialty to the other specialty people started using Botox and it was started using for the cosmetic indications. Gradually the other indications came up. So basically if you look at, Botox was being used for spasms or dynamic wrinkles. So wherever we see the muscles are really spasmodic or there is a lot of tension, or then there were multiple indications they start coming up. People realize that excessive sweating, wherever the areas where like your underarms, palms, you are sweating a lot, injecting Botox helps in releasing. So there was a glandular action. So glandular and muscular actions were being observed. Later on, gradually we started seeing all our muscles which are depressors, they are pulling it down. So why we are aging? See, aging, if you look at, there are 2-3 concepts. One is we are aging due to our intrinsic patterns, our genetics. Secondly, our lifestyles. Third thing is purely gravitational. See, if you look at anything against gravity, gravity is 9.8 g is always there. So you are moving around, so gradually the faces are being pulled down. So all the muscles which are depressors are being strengthened due to the gravitational pull and elevators are weakened. So we learned gradually to master this art, weakening the depressors. So that we are weakening the depressors, automatically elevators are strengthened. I can't strengthen the elevators directly, but weakening the depressor, it improves the facial muscles. And normally what happens is, larger muscles we are using only for medical indications, but when we are looking at facial muscles, these are the smaller muscles inserted into the skin. So these disbalances we can correct it out. So besides muscular activity, crow's feet, dynamic wrinkles, your excessive sweating, we can use it to balance it out. Sometimes some neurological disorders where there is a asymmetry due to the nerve functions, that can be corrected. But besides that, there is one more very interesting indication where botulinum toxin can be used. So that particular indication is like migraines. So that again is associated with that. So people who commonly suffer from migraine, Botox injections help in reducing the intake of painkillers. So this is a brief history and multiple different usages. In India, we started using botulinum toxin say in 2000-2001. At that point of time, majority of the patients either were with the neurological disorders or with the expats who tend to wrinkle fast, because they do, if you look at lighter skin colors, they don't have melanocytes, so they tend to wrinkle faster. So they were the individuals where the botulinum toxin was being used. Gradually now the awareness is there, people started looking at preventive rejuvenation, and most importantly what we realized right now is, because our screen time is increasing, so we all are focusing, we are using a lot of our muscles that's there, the facial muscles and eye muscles. So that again is one of the indications why we need to use toxins earlier and in a preventive role. Thank you.